Hey everyone, welcome back to the Best Health Positively podcast. I'm Krista and I'm so glad you're here today. I'm looking forward to this episode because I know our topic today, social connection, is so important, especially in terms of our health. In fact, the medical research on social connection is quite robust. Now, just a little background here. I became really curious about social connection and how it impacts our health when I was working on an inpatient hospital unit, the acute rehab unit, where we had patients who were admitted for long-term stays, like 1 to 3 months. And I was coaching these patients. This was back in 2017, 2018, before COVID. And I noticed we had plenty of patients who had family or close friends who would visit often throughout their stay over a few months, but there were some patients who had no visitors, no family, no friends. And I really started to wonder how this lack of social connection might affect these patients, from a health standpoint. Now, I was coaching these patients, so I was interacting with them often, along with the doctors and nurses, but they didn't have real social connections, meaning relationships with family or friends. And I definitely noticed this in their demeanor. They were often quiet in sessions and seemed sad. So I really wanted to get into the research on this. And what I found in the research was astounding, that being socially isolated or lacking social connection, as defined in the literature, was a risk factor for all-cause mortality, which means the risk of dying from any sort of disease. And this risk that was posed by not having social connection was equivalent to that of smoking a pack of cigarettes a day or having uncontrolled hypertension. Wow, think of that. This really blew me away because it wasn't something we heard much about. And again, this was pre-COVID. Now, it's important to note that social connection in the research that I was reviewing was defined in terms of real-time connection. So a phone call where you're talking with someone live or seeing someone in person. So texting and social media didn't count. This was research focused on real-time connection. Again, this was before COVID, and the research was clear even back then that lacking social connection was a serious risk factor to our health. Although at the same time, this wasn't something we were hearing about. I know this is something I've never talked with my doctor about. This wasn't anything I had ever discussed in terms of my overall health plan with anyone in the medical field. So this really prompted me, first of all, to design a program to promote more social connection in these patients who were hospitalized. But it also got me thinking more broadly about social connection, even in terms of my clients, and the need to include social connection in our talks about health. Of course, we would discuss many other aspects about health, but it was clear that social connection really deserved some serious attention. And it's important for me, too. At this point, I was thinking in terms of my own health, but it's important to point out with clients and to talk about social connection in terms of relationships and their level of connection or their lack of social connection so that we could address it. But for myself, I also wanted to make sure I was prioritizing the relationships in my life. And how I will say I'm definitely a people person and I place great value on my relationships, especially with family. But I was committed to looking at this a little more seriously. And just a note here, I think one of the important points is that we're not simply talking about social connection as go out and be social. No, we're talking about real connection, being connected in relationship with at least several people in your life that you see and interact with often, not superficially, but people that you're engaged in relationship with. I mean, after all, we are social beings. We are neurologically hardwired for connection with others. We literally need connection. It's no wonder that lack of social connection poses such a risk to our health. Now, I plan to do a longer episode soon where I elaborate more on this because I believe it's really important and it doesn't get enough attention in our discussions about health and the things that we can do to promote social connection and the relationships in our lives. And of course, there's been so much more interest on this topic following COVID. So again, look for an upcoming episode where we get more in depth about social connection. But in the meantime, I hope this is your takeaway today, that connection is really important, and it's something we can control and make a strong effort to stay connected with the people in our lives. Or if you're realizing you're someone who's lacking social connection, let's talk about ways that you can connect with people. And if that's you, I'd love to help. Please message me. So I'd love to hear from you guys, hear more about your experiences with connection and whether there are questions you have or maybe areas you'd like to hear more about in terms of social connection. And if there's any way I can help, I'd love to do so. So thanks for being here, and I'll see you here again next time.